However, the global landscape is changing, as we all know. Donor fatigue is real. So without filling the gap through domestic resource mobilization, our PHCs will be stagnated. In fact, it will even continue to decline in the area of provision of basic healthcare services to vulnerable Nigerians. The Federal Ministry of Health, as we all know, has been working closely with the legislators to improve domestic resource mobilization. And these efforts have been on. We have also all committed to the National Health Sector Renewal Investment Initiative, which was approved by His Excellency President Bola Ahmed Tinubu, and that has brought everyone together, all stakeholders, including donor funding, under one platform, and it is the compact. All subnational governments have signed the compact to align to the vision of the President and also commit to domestic resource mobilization. And that's the only way we can improve our population health outcomes and enhance governance, and also have effective regulations around delivery of healthcare services. The strengthening of the basic healthcare provision fund, which is the most powerful domestic resource mobilization mechanism to drive our UHC aspirations. And this is designed to ensure basic minimum package of healthcare services are made available to all Nigerians.
Association of Health Journalists, on a subject that sits at the very heart of our national health security and the well-being of every Nigerian family. The topic, domestic resource mobilization in the face of dwindling foreign grants and aid, is a very important one. And I speak as a servant of the state and as a professional, profoundly aware that durable health outcomes are created where sound policy, predictable domestic finance, and strategic partnership converge. So government is truly aware of these challenges and are taking proactive steps to make sure that Nigerians, do not suddenly wake up and could not be able to access relevant health services. So therefore, we must be candid about the fiscal constraints that frames our options, definitely. Macroeconomic pressures, rising debt service obligations, and competing social priorities compress the fiscal space available for health. Nigeria's public finances are undergoing necessary rebalancing, but this also means we cannot rely on simple substitution of foreign grants with unfunded domestic promises. Our response, therefore, must be strategic, evidence-based, and audacious. Therefore, the response to this dwindling dollar support and the challenging for sustainable domestic resource mobilization must leverage existing successful approaches, like the ones that I've just mentioned, with ambitious plans to expand the finance base while we continue to learn from things that has worked in other places outside Nigeria. We are asking partners to shift more resources into system strengthening, risk pooling, and catalytic instruments that accelerate domestic financing, rather than funding recurrent costs alone.
Perform our own duty and ensure that our obligations are well represented in this area.
Domestic resource mobilization in the face of dwindling foreign grants and aids captures the urgency of our time. Nigeria's health system stands at a critical crossroad. The global decline in foreign aid, including significant reductions from major international platforms such as USAID. As health journalists, we stand at the heart of this transformation. Our work shapes public perception, influences policy decisions, and ensures that government commitments are not only made but for